Hi, Dr. 𝗙𝗏 here. Wanted to do a peptide video on how to put them in you. This is for those of you who are new to peptides, have maybe never injected peptides. Specifically, this is on how to inject peptides, okay? So in a minute, I'm going to just focus the camera down towards the table so I can demonstrate really how you do this, and you don't need to be looking at my face. But again, really quickly, just learning how to get the peptides, reconstitute them. What does that mean? How to draw it up, how to put the water into the peptides, safety, storage, troubleshooting, etc.
As always, this video is for educational purposes only and does not constitute medical advice or create a doctor-patient relationship.
So here we have my surface. It's really important that your surface is clean. Okay, we're talking about injecting ourselves with something. So let's make sure our preparatory area is clean. Supplies. So obviously you're going to need the peptide, whatever peptide that is. Now, if you happen to see what company this is from, I'm not promoting this company. This is really demonstration purposes only. I like the company I'm using currently. However, maybe that'll change in the future. So if you happen to see it, don't hold it like, oh, Dr. 𝗙𝗏 really insists on me using that company as the best one. So for today, 𝗏𝗡, this is one of my new favorite peptides. It's been helping me a lot. I've been using it. So you need your peptide. You need your back water, which stands for bacteriostatic water. Okay, this is basically just water. This is what we are going to pull a little bit of this out of this vial, out of the back water vial, and put it into the peptide vial. Okay, so you'll need that. You'll need a syringe. So what I have here is a 1 cc syringe, which is the same as a 1 ml syringe. Usually when we're talking about syringes, we say cc. It is 100 units. So hopefully you can see that right down there. 100 units. 1 cc. A lot of times people will have a 50 unit syringe or a 0.5 cc. It might be just as long, but it's more narrow, so it only fits in half the volume. So half of an ml is equivalent to half of a cc is equivalent to 50 units. Okay, a unit is each tiny little tick mark. I'm going to insist that for anyone new, you use a peptide dosage calculator. There are probably 100 of them online now. I will put one in the link below that I like. It seems to do a good job, but I'm not promoting anything else that isn't necessarily on that page. I'm just using it as a peptide dosage calculator. Okay, now you'll probably get a whole bag of them. These can be found on Amazon. You can get them from us. Preferably you get them from Amazon because it's a lot cheaper in the long run. What else? I'm going to uncap this. This is a 29 gauge needle, 1/2 inch long. Okay, usually you want a 1/2 inch long. It can be a 28, 29, 30 gauge. 30 gauge is about the thinnest needle there is. That's what people use to inject insulin. Insulin is a peptide. So peptides have been around for a long, long time being used in medicine. But this is a 29 gauge, 1/2 inch, 1 cc needle syringe. Okay, now you're not technically supposed to have a recap, but I'm just showing this at the beginning. You uncap this. This is the plunger. And then we'll uncap that once we're ready. You'll also want an alcohol swab, is a good idea. I don't use these very often, and I'm not supposed to say that as a doctor, but as long as we're working with a clean area, we don't need to be working with a sterile area, okay? The reality is there's bacteria on my skin, okay? Even if I didn't use alcohol swipe, the surface area that is the tip of this needle pushing bacteria in through my skin is not going to infect me. okay, as long as I'm going into a healthy, clean area of skin. If that were going to infect me, think about every little dental bleed you had, every little hemorrhoid bleed you had, every time you got a cut, it would get super infected, right? That doesn't happen to anybody who has a reasonable immune system. So alcohol swabs are a little bit overdone, but technically as a doctor, I'm supposed to say always use an alcohol swab. And then some people will want gloves. That's really only important if you're doing it to someone else. Okay, the only time you're really going to get blood is, after you go in with the needle and come back out. There might be a little bit of blood sometimes. Sometimes you just can't help hitting a tiny little microscopic vein. Okay, you will want a sharps container. I have a kind of big one. These are available on Amazon. It's kind of big, but it's just what I had left over, so I'm using it. You can certainly get a smaller one, much smaller one, much more convenient. Your syringe with needle attached should always, 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 always go in there. Never does it go anywhere else, ever. Alcohol swabs, I'm not too stringent on. These I'm very stringent on. Yeah, and then just a clean workspace. Obviously, you can have a little Band-Aid afterwards if you want. I never use a Band-Aid. Just adds time and hassle as far as I'm concerned. Wash your hands thoroughly. I usually do these after I've taken a shower, typically. But if not, if I'm feeling a little dirty, I'll use some alcohol and just swab it off, clean my skin. Then you don't really need gloves if you're doing it to yourself. Okay. So I think we just get right into it. One more thing I do, not everybody does this. You can certainly mark down your own, have your own little sheet of paper, or maybe it's on the computer with your exact how much backwater you are going to put into each vial, right? It's easy if you're doing just one peptide, but sometimes you might be doing others. I'm showing you I have 𝗥𝗘 peptide here that I'm currently doing, and TB500 that I'm currently doing. Currently with the company that I'm using for my patients, they have two vial sizes. One big one that can fit up to about 7.5 mLs into it if needed, and one smaller one that can only fit in about 3.5 mLs of backwater. Potentially, you don't have to fill it all the way up. Depends on what dosage you're taking. But I do like to use a little Sharpie, very fine ballpoint, just some pen that can actually write on this. This is one that I actually just use so you can see. It's 10 milligrams, TB500. I just put in here, I put in 1.0 mLs, and I'm doing a 5 milligram per week, once a week. So each time I'm going to be pulling up half of a cc, okay, or 50 units. Okay, so I'm just showing that as something that I do. Not everybody writes on their little vials. This old vial of this already used vial of 𝗙𝗏, I put in 1 ml, and my regimen is 2.5 milligrams 3 times a week. So Monday, Wednesday, Friday. So I don't even know if you can read it there, but I put in 2.5 milligrams equals 0.25 mLs, or 25 units. So 25 units, in other words, 25 units, just pulled up between the 2 and the 3, the 20 and the 30. 25 units is 2.5 milligrams. Now, I very purposefully used the dosage calculator to say, because you typically want to inject between 10 and 50 units is the most ideal volume to inject into your skin, just because anything less than 10 units, the dosage gets it gets easier to become less accurate. Anything over half of an ml or half a cc or 50 units tends to just be a lot of volume. And so it can kind of produce a little lump. You can kind of gently massage that lump out, but it's more likely to be a little bit more painful too. We don't need to make ourselves miserable, especially if it's, a long-term protocol. So those are some things. I think that's it. I will get into it. Okay. Oh no. So don't recap your needle like I just did. Sometimes, depending on which peptide, maybe you'll be given a larger syringe. Now this syringe does not have the needle already attached. Okay, but this is a 5 cc syringe. Maybe you'll get a 3 cc syringe. This can be really useful initially because, and I'm going to attach a little needle. So all right, now for this 𝗙𝗲 10 milligram vial, I am going to put in 1 ml, okay? Because I know that if I put in 1 ml, I can pull up 25 units to get my 2.5 milligram dosage. Now, use the calculator. Use a peptide dosage calculator to figure out what you want. Again, ideally, you're aiming to inject between 10 and 50 units, but depending on what milligrams guidance I give you or somebody else gives you, that will determine how much volume of backwater that you are going to put into the peptide vial. Use the calculator. This GHK, there's 75 milligrams in here. Now I'm only using currently I'm doing 2 milligrams per injection. So I put in the max I could, which was 7.5 mLs of backwater into this, so that 0.1 mLs or 10 units equaled 1 milligram. The math is math. The math is mathing. The math is nice that way. So because I put in 7.5 mLs here, I chose to use a bigger syringe, right? Because then I'm going in, drawing up 5 mLs once, putting it in, and then drawing up 2.5 mLs and putting it into the peptide vial. That's only 2 things. Versus if I had used a 1 cc, I would have had to do that 7.5 times or 8 times, but 7 full syringes and then ending with, on the 8th time, a half a syringe full, right? So hopefully that makes sense. It's just harder. That's why sometimes a larger syringe is nice, though not completely necessary. For this one, for this 𝗙𝗲, I'm only injecting 1 ml, so I could totally use this, right? Because this is exactly 1 ml, 100 units. So let me uncap this. Proper way to do this. This backwater is already open, so I'm going to pull out the little alcohol swab. I do like to always use an alcohol swab on the backwater, on the rubber part. Okay, that's a good idea. Now, set the alcohol swab to the side. I'm going to pop the top off of the 𝗙𝗲 vial, so this little top came off. So that really should be sterile under there, so I don't really need to wipe it with alcohol. You can if you want. How to do this? You aim right in the center. There's like a target circle there. You want to aim right in the center of this. These are also under pressure. So I've already let a lot of air in, but ideally you'd want to, if this were brand new, you'd want to pull back however much volume. You want to pull back the same volume of air and then put it into the bottle, into the vial, because these are under vacuum. So if you don't allow some air to go in, it can be very hard to pull the backwater out, or more importantly, the peptide. So invert it. And I'm pulling all the way up to 100 units, which is the same as 1 ml, same as 1 cc. Pull it out. Set the backwater aside. This is 1 ml. This, I don't know if you can see, but it also has a little target zone. So you want to stick it right in that circle And be gentle. These needles are delicate, so you want to do this part carefully. Now, let's hold it back. There's a vacuum in there. So the moment I put this in, the plunger started going down on its own. However, I stopped it. I want to show you a couple of things. You want to be able to see the needle within that crevice there, the rubber stopper. Part of it goes all the way down, but then there's this crevice. So there's like two halves of the rubber stopper. You want to make sure you see the tip of the needle between that. I don't know if you can see that. The other thing is this white powder is the peptide, and those are delicate. It's delicate. And so you want to let the water in slowly. So I'm actually going to, this is straight, I'm going to slant it so that the tip of the needle really is going down on the side of the glass vial inside, so that I'm not just blasting, and you can see the plunger is going down on its own. I'm not pushing it in because, again, the vacuum, it's just being sucked in under the vacuum pressure. You want to go slow. You don't want to destroy your peptide. Okay, so that went in completely on its own. Now, you can see there's a little bit of white still. Ideally, now you can pull the needle out, the syringe needle out at this point. I just hold it there because I'm going to pull up the volume I want. And you just want to gently roll. You can roll it like this. You want to mix it, but you don't want to shake it because you don't want to break those peptide bonds. You want to get your money's worth. These are not inexpensive. So I'm just kind of slowly rotating. Again, I'm not like, this vial is all done. I'm not like this, right? You don't want to shake it. That will destroy. Some of the peptides are more delicate than others. So just want to make sure. Now try to minimize bubbles. If you have a few bubbles, they will go away. I'm just trying to rotate, get the white stuff completely dissolved. So it's totally dissolved now. It looks just like water. And we will see. There might be still too much vacuum here. But again, using the calculator, so push the plunger all the way down. I only want to pull up 25 units. So just pull up slowly. Yeah, see, I'm going to need to actually take the needle out. So this is perfect. Love it to show it to you. I'm going to need to take the needle out because I've pulled this all the way back to 50 units and no liquid is coming into the syringe. So there's way too much vacuum pressure underneath there. So I'm going to pull this out. I'm going to pull the plunger all the way back. I'm going to aim for that target. Watch the plunger as I go in. I'm not going to push it, but I'm guessing that it will go down on its own. Now, I'm only injecting air this time, so I don't mind that it goes in a little bit fast because the tip of my needle is not in the liquid. It's up above. So I just put a whole nother ml. Let's see. I might need to put in more air in there just in order to be able to pull back. Nope, that was enough. So it's pulling. I pull back slowly. Again, want to be gentle with your peptides. And you also don't want to pull up too many air bubbles. So I pull it up to 25 units right there. Take it out. Now you can see there's no air bubbles. If there were air bubbles, what you can do is you can pull it back. You see the level of the liquid now is right there. You can kind of give it a mild little tap. Again, it's kind of like you don't want to shake the vial up. You don't really want to do too much of that here either, but a little bit of just light tapping gets every single bubble up. And then I'm going to go all the way. I'm going to push the plunger back in until the air is totally out. Again, I don't want to waste the peptide. Injecting a little bit of air is not a big deal and not painful at all. And you can see, not that you always want to go this far, but you can see that tiny little drop. So you definitely wouldn't want to inject or let any more fall out, okay? Now, I don't know if you can, probably won't be able to see this, but if you look closely, the tip of the needle is beveled. So there's a pointier side to it, and then it kind of slants off. The pointier side should go, when I'm injecting, should go closer to the surface. Like if you're landing a plane, the pointier side should be the landing wheels on the ground, which is your skin. Now, let's just, again, you can use the alcohol. I don't almost ever use alcohol on my skin, but I'm a good doctor, so I'm going to demonstrate. You just grab some skin like this, okay? Even the skinniest of us have, well, of us, I don't know if I'm in that category, but even the skinniest people can grab some skin there. So again, pointiest part of the needle down, 45-degree angle, and some people just jab it in. Personally, I don't like to do that, but when you're using a 29 gauge needle or a 30 or a 28 gauge needle, it rarely hurts at all, and if it does, it's just momentary. Now, keeping the skin pinched, I kind of push down because I want the peptide to get as far in as possible. 𝗙𝗃, and then I'm just going to inject slowly because I don't want burn. This has not hurt at all. I inject slowly. If you do it fast, it'll hurt a little bit worse if it hurts at all. Now, 𝗙𝗃 does not burn. It's not, the pH is just right, so it doesn't burn. Let's see. Oh, well, I'll just pull out. Now, we'll see. Maybe I get a little blood, maybe I don't. So there's no blood there. If there were, I would just put my finger on it for 10, 20 seconds. Just kind of little motion. If you do feel a lump of liquid under there, you can just kind of, again, slow motion, do that. That did not hurt at all. Some peptides like GHK, for instance, it's more acidic, so it can burn, so it's really nice to get it deeper rather than closer to the surface of the skin. The closer it is to the surface of the skin injected, the more it will burn. Another little trick, if you're scared of needles to begin with, which you'll get over real quickly, what you do is you can just scratch the skin a little bit. It kind of distracts you, and then you go bump pretty quickly. Just distracts the skin and makes it a little less sensitive. Once you're done, into the Sharpies container. Okay, now I could have used my little Band-Aid wherever it is. I don't ever use these, just for demonstration purposes. For storing peptides, I just injected this, but before you reconstitute it with backwater, store them in the fridge, cold, dark area. Do not freeze them. They can stay good for, almost all of them can stay good for at least a year. So a long time. Once you reconstitute peptides, they will start breaking down almost immediately. However, most of them will last weeks and weeks and weeks if you store them in a cold, dark place like a refrigerator, again, not a freezer ever. Some of the peptides need to be used within a few weeks. Some peptides need to be used within 4 weeks, some 6 weeks, some 8 weeks. Some will last many months. But while I say they start deteriorating right away, it'll be like really low. So it's like 1%, 2% less effective. That's not a big deal, right? But eventually there's going to be this drop off where it just gets much less and less affected. Sometimes if you do get a blood vessel, you will have a little bruise there. You just want to it'll heal. Like little bruises like that usually heal really quickly because they're such small blood vessels. You want to kind of rotate sites because anytime the injection itself is a little micro trauma, so it can get a little red or inflamed potentially. You can always just use a little ice on there, ice pack if you want. But just generally people usually inject around this kind of abdominal spare tire region. You can go elsewhere on the body, sometimes with BPPC 157, for instance. If I had an elbow pain, I would inject right kind of locally-ish. But most peptides, you can just kind of go into this area. But you can do it anywhere where there's like a little bit of subcutaneous fat. So it could be up here, it could be on your thigh, but most people go here. Timing of peptides. So something like DSIP or DSIP, short for deep sleep inducing peptide, that you're going to want to do 30 to 60 minutes before bedtime or before sleep time. Something like 𝗙𝗏, which is, this is basically your like exercise in a bottle, not to oversell it, but it's mitochondria. It helps mitochondrial efficiency dramatically. This is like my favorite peptide, I think. It could be energizing, so I would do it in the morning, sometime in the morning. Something like TB500, this is more of an immune system thing, so you can kind of do it any time of day. Don't do two peptides like in the same place, unless it's a mixed bottle. Some vials do have a mix, like ipamorelin and CJC oftentimes come together. That's obviously fine, they're in the same vial. But in general, you want to do different peptides in different locations. One last thing. Okay, I'm just going to use this. Sometimes if you go in real rough, you can kind of bend the needle. So it might come out like that, right? That's bent. You can still use that needle as long as it's not, I'm going to use this to bend it more. I wouldn't do that because that's probably going to be pretty kinked. So I wouldn't use that needle, but I'm going to use the surface here to bend it back. But if it's like a little bit bent, that's totally fine. Again, as long as it's clean still. That's totally fine to still inject. You might not want to use a bent needle the first time, but as a doctor, I'm supposed to say discard this and use your perfect one. The reality is this is still a needle. The peptide fluid is still going to flow through it. Not a big deal if it's a little bent. Huge fan of science, also a huge fan of logic, as I always say. I believe that's it. Let me put my face back up. I'm going to sink down to it. I believe that's it. This, usually for videos, I don't ever look at the comments that I post on YouTube. But this one, I think I will, just because there could be some good questions. And so I'd encourage everyone to look at the comments, just in case. Again, I will put the a peptide dosage calculator in there. I'm not tied to that one at all. It's just one that I think is really clear and easy to understand. I don't promote anything else on there. And without further ado, I think that's it. So hopefully this helps peptide injection newbies. Take care.